Amy has a background in health behavior science and health promotion. She has previous experience working in healthcare administration, patient care, and health education. Amy received her master's degree in health promotion from the University of Delaware. So Michelle, please take it away.
Thank you. Good afternoon, everyone. Let me just close all these other windows. So as Kendra mentioned, and thank you, my name is Michelle Bove, and I am one of the health educators with the Communicable Disease Service. And I'd like to thank all of you for joining today. I know we have a pretty big group while we discuss some tick-borne education. So starting very high level, what are tick-borne diseases? Tick-borne diseases are illnesses that can be spread to humans by the bite of an infected tick. Ticks are vectors that can carry
and health education. Amy received her master's degree in health promotion from the University of Delaware. So Michelle, please take it away.
Thank you. Good afternoon, everyone. Let me just close all these other windows. So as Kendra mentioned, and thank you, my name is Michelle Bove, and I am one of the health educators with the Communicable Disease Service. And I'd like to thank all of you for joining today. I know we have a pretty big group while we discuss some tick-borne education.
So Michelle, please take it away.
Thank you. Good afternoon, everyone. Let me just close all these other windows. So as Kendra mentioned, and thank you, my name is Michelle Bove, and I am one of the health educators with the Communicable Disease Service. And I'd like to thank all of you for joining today. I know we have a pretty big group while we discuss some tick-borne education. So starting very high level, what are tick-borne diseases? Tick-borne diseases are illnesses that can be spread to humans by the bite of an infected tick. Ticks are vectors that can carry infectious agents such as bacteria, viruses, or parasites. Most ticks go through 4 life stages: egg, larva, nymph, and adult, which you could see all in this photo. After hatching from the eggs, the ticks must actually eat blood at every stage of their life in order to survive. So in this photo, you could see it's of a black-legged tick, and A is the larva, B is a nymph or young tick, C is an adult male, D is an adult female, which you could see is substantially larger, and E is an engorged adult female with eggs. So ticks become infected with germs when feeding on small infected mammals such as white-footed mice or voles. An infected tick can then infect a person through a bite. It is, in fact, possible to be infected with more than one tick-borne disease at the same time if the tick is carrying multiple bacteria or viruses within itself. The animal or person that a tick feeds on is called a host. Ticks find their host by detecting breath and body odors or by sensing heat, moisture, vibrations, things like that. And some species can even actually recognize a shadow. One thing I like to bring up here, because when I started, I did not know, is that ticks cannot fly or jump, despite what many people may think. Depending on the species, they'll either hunt for a host or wait for a host, which is known as questing. So ticks that wait for a host in the questing position, they hold on to the leaves of the grass by their 3rd and 4th pair of legs, which you can kind of see in the photo on the left. They hold their legs outstretched, waiting to climb onto the host. And then when a host or person, whatever it may be, brushes by, the tick climbs aboard the person. Ticks live in or near woody or grassy areas. You can find them in leaf litter, away from paths, and in bushy areas. Anyone who is bitten by an infected tick may get a tick-borne disease. People who spend a lot of time outdoors have a greater risk of becoming infected since they're more likely to be exposed to ticks. And the main thing I'd like to emphasize here is the off-path bushy areas. We always encourage people to stay on path, especially in this instance, if your school is in a very wooded area, to very much encourage use of the pathways. Generally, the early signs of a tick-borne disease include the symptoms you see here, which could be rash, fever, chills, aches, and pains. However, each tick-borne disease is different, and it could vary. The symptoms could, of course, vary person to person. So we'll examine the signs and symptoms of particular tick-borne illnesses as we discuss the diseases in more detail today. Before we jump into the actual diseases, we're going to briefly discuss the ticks in New Jersey that can spread disease. So all of these photos here show what the adult versions of the tick look like, but even the tiny nymphs can transmit disease. So letter B, I believe it was in the previous picture, and you will also have it on a copy of your slides. Those tiny nymphal ticks can also spread disease, which is why it's so important to be on the lookout. So first up, the black-legged tick, also called the deer tick, can transmit Lyme disease, babesiosis, anaplasmosis, and Powassan virus. The Lone Star tick can transmit ehrlichiosis, southern tick-associated rash illness, which is also known as STARI for short, tularemia, Bourbon, and Heartland viruses. And lastly, the American dog tick can transmit Rocky Mountain spotted fever and tularemia, which is rare but potentially a very serious illness. So this is a good photo for comparison. Here we can see the 3 types of ticks that we just discussed in each stage of life. And then you notice the dime for reference in the top right-hand corner. Ticks are extremely tiny. As we saw in the previous slide, 2 different species of ticks transmit different diseases. So being able to identify the type of tick and its life stage can be very helpful in both the prevention and the treatment of tick-borne diseases. I do like to take a moment to apologize in advance for this photo, because if you like sesame or poppy seeds, you might not after watching this or seeing this slide. So in general, adult ticks are about the size of a sesame seed, while the nymphs are approximately the size of a poppy seed. On the left, we can see a photo of both a male and female adult black-legged ticks on a sesame seed bun. And the right-hand side photo, you see a zoomed in picture of a poppy seed muffin, and it has 5 nymphal black-legged ticks on it. Here, I always like to give everyone just a couple seconds to see if you could spot the 5 ticks. No reward or anything, but it's just neat to be able to see how small they are and being able to identify them. You'll also have that on your PDF of your slides if you want to refer back to it later on. So today, for the sake of time, we're going to review the most common tick-borne diseases in New Jersey, which are Lyme disease, babesiosis, anaplasmosis, ehrlichiosis, and spotted fever group rickettsiosis, which includes Rocky Mountain spotted fever. That's the one that most people have probably heard of. And we're going to discuss the diseases mentioned in more detail. And as I mentioned, we're going to do it by tick type. So we're going to begin with the diseases spread by black-legged ticks. So we're going to discuss in this section for diseases spread by black-legged ticks. We'll be talking about Lyme disease, babesiosis, and anaplasmosis. Regarding black-legged ticks, we do have established populations of black-legged ticks in every county in New Jersey. I know this was a popular question. So a tick population is considered established if 6 or more ticks of one life stage, or at least 2 ticks of different life stages, are found within 1 year in that said county. If fewer than 6 ticks of one life stage are found within 1 year, they're considered to be detected but not established. I know that was a lot, but when we talk about the other types of ticks, you'll see the difference in detected versus established. So as you can see, the black-legged ticks on that map, they're established in every single county. So first up is Lyme disease. And Lyme disease is the most commonly reported tick-borne illness in New Jersey, but also nationwide. As you can see in the map, most cases are concentrated in the Northeast and Upper Midwest regions. Lyme disease is caused by a type of bacteria. Earlier on, we mentioned it could be caused by bacteria, viruses, or parasites. So I always like to have people on the lookout for what causes the specific disease. So for Lyme disease, it is bacteria. The bacteria that causes Lyme disease is called Borrelia burgdorferi. You won't be quizzed on that. And it is transmitted to humans through the bite of an infected black-legged tick. These ticks are widely distributed in the northeastern and upper Midwestern parts of the United States. Please note the map in the yellow shows the approximate distribution of black-legged ticks in the US. So we saw the distribution earlier in New Jersey, and now we're seeing it in the US. The scientific name of the black-legged tick is Ixodes scapularis. In general, black-legged ticks need to be attached for 36 to 48 or so hours before they can transmit Lyme disease bacteria. That being said, that is the typical number of hours and not the exact number of hours, as it has been seen to transmit in less time than that, around 24 hours or so, but that is the typical range. Different people exhibit different signs and symptoms of Lyme disease. Usually the early stage of Lyme disease is marked by one or more of these signs and symptoms you see here. So fatigue, chills and fever, headache, muscle and joint pain, and a rash called erythema migrans, or EM rash for short. Symptoms typically appear within 3 to 30 days after infection. And keep in mind, these are early signs, and we'll also discuss late signs of Lyme disease shortly. Most people, approximately 70 to 80%, will develop this erythema migrans or EM rash. I would remember that. So 70 to 80% approximately will develop this EM rash. You might be asked that eventually. That's just a little hint. Appearance of the rash can vary widely and may appear on any area of the body. The rash begins at the site of the tick bite after a delay of about 3 to 30 days, which was previously mentioned. The average is about 7 days or so. The site of the rash can feel warm to the touch, but it's not often itchy or painful, anything like that. Over several days, the rash will gradually get larger, and sometimes it starts to clear as it gets bigger, resulting in that target or bullseye appearance. A lot of times when we think of Lyme, we think of just strictly that bullseye rash like you see in the bottom right photo, but it can in fact look like any of those photos in that picture. Some signs and symptoms of Lyme disease may not appear until days to months after a tick bite. If left untreated, Lyme disease can produce a wide range of symptoms depending on the stage of infection, and you could see the list on the left-hand side. Right-hand side, sorry about that. In areas where Lyme disease regularly occurs, such as New Jersey, a single dose of doxycycline, which is an antibiotic, may be used as a prevention measure after a tick bite. And these areas are shaded in yellow on the map. So anywhere that you see that yellow shading on the map, New Jersey included, of course, it may be of benefit to receive a single dose of doxycycline following the bite of a black-legged tick. Certain conditions do need to be in place, so 5 different conditions in order to receive that prophylaxis. So 1, the tick bite needed to have occurred in an area where Lyme disease regularly occurs. Once again, those yellow areas. The tick was removed in the last 72 hours, so you definitely have to get ahead of it. The tick is engorged and not flat, indicating it was feeding for some time. The tick is a black-legged tick because that's the type of tick that spreads Lyme disease. And just the antibiotic needs to be safe for the person who was bitten, so making sure there's no allergies or allergic reactions, anything like that, to the antibiotic. Next up is babesiosis. People and pets can become infected with the parasite that causes babesiosis. So this one's a little different as it is caused by a parasite. I like to make note of that. And once again, you could see the map of the concentrated cases. Babesiosis is caused by microscopic parasites called babesia. The main way babesia parasites are spread is through the bite of an infected tick. One type of parasite called Babesia microti is spread by black-legged ticks, usually in the young nymph stage. So if you remember the wonderful poppy seed muffin photo from earlier in the presentation, those were nymphal black-legged ticks, and because they're so small, the tick bite can really go unnoticed. The photo on the bottom here shows a black-legged nymph on the face of a penny for size reference, while the photo at the top depicts how black-legged nymphal tick becomes engorged after feeding for several hours. So you could see the range, how it starts off from 0 all the way to 96 hours, and how engorged it in fact does get. Many people who are infected with Babesia microti feel fine and do not have any symptoms, while some people develop flu-like symptoms. Babesia parasites can infect red blood cells and can cause a disorder in which the red blood cells are destroyed faster than they can be made. The disease is more severe in people who do not have a spleen, have a weakened immune system, are elderly, or have any other serious health conditions. Next up, we'll discuss anaplasmosis, and keep in mind these are still diseases that are spread by the black-legged tick specifically. Once again, people and pets can become infected with the bacteria that causes anaplasmosis. So we're back to being caused by a bacteria as to where the previous was a parasite. And here you see the concentration of cases on the map also, and you see they're fairly similar. Anaplasmosis is caused by the bacteria Anaplasma phagocytophilum. Like Lyme disease, anaplasmosis is transmitted by the bite of infected black-legged ticks in New Jersey. In rare cases, the bacteria can be transmitted through blood transfusion or organ transplant, though it's very, very rare, but we do have to mention it. Signs and symptoms of anaplasmosis typically begin within 1 to 2 weeks after the bite of an infected tick. Early signs and symptoms, which is considered around days 1 to 5 or so, are usually mild or moderate. And these can include fever, chills, severe headache, muscle aches, nausea, vomiting, diarrhea, loss of appetite. So a lot of times you do see that flu-like symptoms are very common with the tick-borne diseases. Signs of infection typically observed during the first week of clinical disease can also include low platelet count and low white blood cell count. Anemia, a low red blood cell count generally occurs, but if it does, it's later in the illness. Rarely, if treatment is delayed or if there are any other medical conditions present, anaplasmosis can cause severe illness. So again, early treatment can reduce the risk of developing severe illness, and you can see the symptoms on this slide. Now we're going to cover tick-borne diseases spread by Lone Star ticks. And you can see this map looks a little bit different than the black-legged ticks in New Jersey. So established populations of Lone Star ticks are found throughout southern New Jersey. However, the distribution has slowly worked its way up over the years. One thing that happened most recently was that Passaic County now has a detected population of Lone Star ticks as to where they previously did not. So I just thought that was interesting to mention. But on this map, you could see the difference between where the ticks were detected, where they were established, meaning there were 6 or more of the same life stage or 2 different life stages, and you can see where they haven't been detected as of yet. First up is ehrlichiosis. So people and pets can become infected with the bacteria that causes ehrlichiosis. And here you can see the distribution on the map, and you can see it does look a little bit different, but we're also now talking about a different tick, which can also be an indicator. In New Jersey, ehrlichiosis is caused by a bacteria called Ehrlichia chafensis or Ehrlichia ewingi. Most people get infected from the bite of an infected Lone Star tick. These ticks are widely distributed in the southeastern and eastern parts of the United States. So you could see on this map how that distribution looks a little bit different. The scientific name of the Lone Star tick is Amblyona americanum. The tick bite is usually painless, and only about half the people who develop ehrlichiosis may not even remember being bitten, believe it or not. For some people, the saliva from the Lone Star ticks can be quite irritating. I don't know why exactly that is. In rare cases, ehrlichiosis has been spread to people through blood transfusion and organ transplant, but once again, very rare, but need to mention it. And you could see how the Lone Star tick looks quite different than the black-legged tick with that very prominent spot in the middle. I always like to point that out for awareness. Signs and symptoms of ehrlichiosis typically begin within 1 to 2 weeks after the bite of an infected tick. Early signs and symptoms during the first 5 days of illness are usually mild to moderate. Up to 1 in 3 people with ehrlichiosis report a rash, which generally occurs more often in children than adults, so that's really good to note for this purpose. Similar to anaplasmosis, signs of infection typically observed during the first week of clinical disease include that low platelet count and low white blood cell count, and then anemia generally occurs later in the illness, which is that low red blood cell count. And you can see the signs and symptoms listed here. If the person does develop the rash, it typically appears 5 days after the fever begins, and it could look like red splotches or pinpoint dots. So this photo is really good at depicting that. And once again, this is going to be more common in children that you're going to see it. So I wanted to be sure to mention that today. If treatment is delayed, ehrlichiosis can sometimes cause severe illness. And you can see some of the symptoms that may occur here, including damage to the brain and nervous system or respiratory failure, for example. And when we're saying delayed treatment, it's typically, since most of them are spread by bacteria, it's typically delayed antibiotic treatment. Next, we're going to focus on tick-borne diseases spread by the American dog tick. Remember, this isn't an exhaustive list because of the time. We're talking about the most common ones spread in New Jersey. So earlier on the slide where we talked about the different types of ticks, that draws out the different types of disease that each one spreads a little bit more. So established populations of American dog ticks are found in almost every county in New Jersey. And then in the other counties, there are still the ticks detected. So you can see how each map with the different types of ticks look a little bit different. So we're going to discuss spotted fever group rickettsiosis or spotted fevers. Spotted fevers are a group of diseases caused by closely related bacteria. You may be familiar with Rocky Mountain spotted fever, which is the most serious and commonly reported spotted fever in the United States. Human cases of spotted fevers are reported together in a category since most routine lab or laboratory tests are unable to distinguish between Rocky Mountain spotted fever and other spotted fever diseases. But if there is a diagnosis in this area, it would be of Rocky Mountain spotted fever. And here you can see the map, but this is for all spotted fevers. So it's definitely a little more widespread. Rocky Mountain spotted fever is caused by bacteria called Rickettsia rickettsii and spread by several types of ticks in the United States. But in New Jersey, the bacteria is spread through the bite of infected American dog ticks, also called Dermacentor variabilis. And here you can see the distribution of the American dog tick once again in the entire United States. Spotted fevers share many signs and symptoms and can range from mild to life-threatening. The first sign of many spotted fevers is generally a dark scab at the site of the tick bite, which develops a few days to a week following the actual bite itself. Several days after the scab appears, other signs and symptoms may develop. So the signs and symptoms include the dark scab at the site of a tick, also called an eschar, fever, headache, rash, and muscle aches. And notice that there's a little asterisk on the first box next to the dark scab at the site of the tick bite. For that reason, it is because that generally doesn't occur with Rocky Mountain spotted fever, but with the other spotted fevers. So here we'll get into that a little bit more. It can be difficult to distinguish between Rocky Mountain spotted fever and other tick-borne diseases, especially during the earlier stages of the disease. People who get sick, however, with a spotted fever other than Rocky Mountain spotted fever will often have this scab, making it a little bit easier to diagnose, because once again, these eschars or these marks are not common in cases of Rocky Mountain spotted fever, but with the other spotted fevers. I kept some of that brief because I wanted to make time to fit this in. It seemed like a very big topic of interest. So we're going to discuss emerging tick-borne syndromes. It seems a lot of people have been curious about this one. we're going to be discussing alpha-gal syndrome. So before we talk about alpha-gal syndrome itself, also you might hear me saying AGS for short. Sometimes I flip-flop between the two, so sorry about that in advance. But before we talk about alpha-gal syndrome itself, we're going to discuss what alpha-gal is. Alpha-gal is a sugar molecule found in most mammals. Alpha-gal can be found in meat, for example, pork, beef, rabbit, lamb, deer, venison, and products made from mammals, including gelatin, cow's milk, and milk products. Alpha-gal is not found in fish, reptile, birds, or people. Alpha-gal syndrome, once again abbreviated AGS, it's known as a couple different things. You might hear it being referred to as alpha-gal syndrome, alpha-gal allergy, red meat allergy, tick bite meat allergy, different things. AGS is a serious, potentially life-threatening allergic reaction. Unlike other tick-borne diseases, AGS is not caused by an infection. AGS symptoms occur after people eat red meat or are exposed to other products containing alpha-gal. Unlike other food allergies, AGS is characterized by a delayed reaction after consumption, with people often waking up in the middle of the night with symptoms. So a lot of times if you eat something, you're allergic to it or something like that, right away, your throat might scratch, it might start to close, you might end up getting hives or something like that. Everyone reacts a bit differently and the severity does differ. Alpha-gal is a little different because you often don't have that reaction until hours later. So that's something that definitely sets it apart from other syndromes like that. Not all people with AGS have an allergic reaction to every ingredient containing alpha-gal, but most healthcare providers, if you do have AGS, they'll probably advise patients with AGS to stop eating mammalian meat, so beef, pork, lamb, venison, rabbit, everything we discussed before. So the first thing that people start to wonder is what a meat allergy even has to do with ticks to begin with, and I myself thought the same thing. I'm growing evidence, and there's still very much research being done about it, so you might see slides change down the line or content change down the line, and it's because it is still developing. So growing evidence currently suggests that AGS may be triggered by the bite of a Lone Star tick in the United States. Researchers believe that the alpha-gal molecule is present in the saliva of certain types of ticks, such as the Lone Star tick here in New Jersey. And it is spread to humans when the tick bites the human. This exposure can trigger the immune system to develop an allergic response to alpha-gal. How it works is the immune system of someone with AGS mistakenly identifies the alpha-gal molecule, so from the saliva, and then when you eat the mammalian meat afterwards, it recognizes it as a foreign invader, such as a virus or bacteria, and produces an immune response. This response triggers the release of chemicals, including histamine, which cause the symptoms of this allergy. It's worth noting that not everyone who's bitten by a tick will develop alpha-gal syndrome, and the exact reason why some people develop the allergy and others do not is still not fully understood. So that's one of those things that I mentioned is still being looked into, but we'll just continue to use the most current up-to-date information that we have. In addition, other kinds of ticks have not been ruled out, as different tick species in other countries have been connected with the development of alpha-gal syndrome. More research is needed to understand the role ticks play in starting this reaction and why only certain people develop AGS or alpha-gal syndrome. So on the left, you see the distribution of the Lone Star tick throughout the state of New Jersey. And on the other side, you see confirmed alpha-gal cases in New Jersey. And that data is from 2022 to 2023 and will be updated ongoing. So AGS surveillance actually just began in New Jersey in 2022. So you could see the confirmed number of cases here between those 2 years. And the one thing that we really like to point out is notice how the reported cases of AGS on the right resemble the distribution of Lone Star ticks in New Jersey. So you see some of those central and southern areas where there's that established population of Lone Star ticks. We see pretty high numbers in comparison to the more northern part. where they are just detected or not even detected as of yet. So it's interesting to see those case numbers and where they're distributed throughout the state. Further alluding to the Lone Star tick playing a role in it, which I think is interesting. So alpha-gal syndrome reactions can be different from person to person. They can range from mild to severe or even life-threatening. Some of the AGS symptoms include anaphylaxis, which of course would be one of the more severe reactions, hives or itchy rash, nausea or vomiting, heartburn and indigestion, dizziness, faintness, severe stomach pain, swelling of the lips, throat, tongue, or eyelids, drop in blood pressure, and a few others. I mentioned this a little bit earlier, I believe, but symptoms commonly appear about 2 to 6 hours eating the meat or dairy products or after exposure to products containing alpha-gal. So even gelatin-coated medications could sometimes produce a reaction in someone due to the gelatin containing that alpha-gal molecule component. And we'll continue to update everything as we go. We did just come out with an alpha-gal syndrome brochure, which I think I mentioned that later on again when I go through the resources and stuff, but we'll also be sharing a link to that. That is available for you to print. We're also making some print copies ourselves because it is something that was in very high demand. So if you need some copies sent to you, you can always reach out and we can try to get those to you, or you can just download it yourself. But as information continues to develop and more research is done, we'll be sure to keep that resource updated since it is a heavily desired topic to have content on. So now we're going to pivot into the prevention portion. And we're going to discuss a little bit about preventing tick-borne disease in students, but also in general. So reducing exposure to ticks is the best defense against tick-borne infections. Some of the key things is to know where ticks are. I know I mentioned earlier in the presentation that the ticks typically live near woody or grassy areas. So always walking or always having students walk in the center of trails or paths to avoid contact with ticks to the extent possible is definitely very important, especially depending on the location of the school, if you're in a more wooded area and so on. Keep school paths clear, so mowing lawns, clearing brush, and removing leaf litter regularly. Applying insecticides, so using EPA-registered repellent on skin and permethrin on clothing. We do recommend EPA-registered insect repellent and, of course, teaching safe use of this also. Educating students, so teaching students to wear long sleeves and pants tucked into socks to prevent ticks from getting under their clothes. Of course, this is to the extent possible. Light colored clothing makes it easier to spot ticks. So that's just another tip that we would like to share with students. In addition, this is especially important maybe if there's a field trip or something like that coming up where it's something that you might really want to enforce and reinforce through teaching. That's definitely a good opportunity to be able to do so. We do have a K through 12 tick toolkit to help with this education, which I'll mention in a little bit. Encouraging tick checks is also very important. So checking for ticks upon returning from outdoors is vital. Of course, we also recommend showering within 2 hours after being outdoors, but on school time, that might be a little bit difficult. But just really encouraging tick checks to your students overall, especially after spending time outdoors in those woody areas or things like that. Being aware of symptoms. So today we discuss symptoms of the most common tick-borne diseases in New Jersey. So if a student comes into your office feeling ill with these symptoms, it is a good idea to ask about tick exposure history. We saw that a lot of the signs and symptoms do mimic flu-like symptoms too, which could make it a little bit tricky. So that's why we really do encourage, if a lot of time is spent outdoors or if any tick exposure is known of, to definitely inquire about that. So here we have just a photo of the spots you should check for ticks. We also will include this in the resources, and CDC also has some images that are great for both people and pets and where to check for ticks. Checking the body for ticks after being outdoors can reduce the chances of getting a tick-borne disease. Conducting a full body check after being outside, even in one's own backyard, is advised. And be sure to check all the areas listed on this slide along with ankles and back. Removing an attached tick. If you find a tick attached to your skin, you want to have it removed as soon as possible. The steps for this is you want to use fine tip tweezers, which you could see in photos 1 through 3, and you want to grasp the tick as close to the surface as you can, which you could see in image 2. You want to pull upward straight and steady with even pressure. You don't want to twist it or jerk it, anything like that, because it could cause the little mouth parts to break off. And if this happens and the mouth part does remain stuck, you want to try to remove the mouth part with tweezers to the extent possible. After removing the tick, which you can see in image 4, you want to thoroughly clean the bite area with rubbing alcohol and clean your hands with soap and water. There are a lot of, I guess, rumors or folklore remedies that are discussed, things like that, such as painting the tick with nail polish or using petroleum jelly, Vaseline, things like that, or using heat to make the tick detach. So the goal is to remove the tick as quickly as possible, so we don't encourage those methods where you want to wait for the tick to detach itself, because who knows how long it could remain attached. That's why we do advise this method as the best method. This is also something useful to, of course, teach students. I would assume that it might vary, the policies and stuff around school nurses and what they can and can't remove and things like that. So I would leave that question strictly for your school. That's not something that I want to answer, but we do encourage that tick removal as quick as possible. So disposing of a tick, you never want to crush the tick with your fingers, anything like that, and it probably wouldn't even get rid of it if you did so. You want to dispose of a live tick by putting it in alcohol or hand sanitizer, placing it in a sealed bag or container, wrapping it tightly in tape, or my favorite, just flushing it down the toilet, knowing that you got rid of it. This is a good resource I wanted to share, especially with this audience. The Tick Bite Bot is the CDC's interactive tool to help people remove attached ticks and determine when it is appropriate to seek healthcare after a tick bite. So it is an online tool. It's also mobile friendly. So depending if you're moving around or within the office, it covers a series of questions regarding tick attachment, time, and symptoms. And based on the response that you put in, whether it's for yourself or a student, the tool will then provide information about the recommended actions and resources. You can access it by scanning the code you see here, which was just replaced this morning. So thank you to my colleagues for going in and replacing that. As of right now, this QR code should work and the links we're sharing with you today should work, but I will mention that a lot of you may have noticed that as of this morning, I believe it was, CDC released all their new web pages and links and stuff like that, and they're archiving a lot of pages. And so at the state, we do link to the CDC a lot. So you might see that we're in the process of updating our web pages to make sure that those links work and everything. So if you're looking for something and can't find it, that might be the reason. But we are going to work as quick as possible to at least get the New Jersey pages updated for you. So I just wanted to mention that. Now we're going to discuss some tools and information that may be beneficial to you or teachers or your jurisdiction in general. So first, I'm going to touch on the K-12 legislation and the toolkit. There is actually a statute that requires local educational agencies to provide instruction on both prevention of Lyme disease and other tick-borne diseases in grades K-12, so kindergarten through 12th grade. And then there was also additional legislation signed by Governor Murphy in 2023, which in the PDF version of the slides, I believe you should be able to click those links and they work. But if not, you can go to the site that has all the New Jersey bills and legislation, and you could also look it up there if necessary. So we wanted to support educators and people who work at schools to the extent possible, because we know everyone is extremely busy, whether it's caring for students, creating lesson plans, all of the above. So New Jersey Department of Education and New Jersey Department of Health collaborated to select and create materials to support educators in instructing students regarding ticks and tick-borne diseases. We call it the New Jersey Department of Health School-Based Tick-Borne Education Toolkit, and it pretty much contains everything you would need to teach the lessons, including the PowerPoint slides and scripts, activity sheets, quizzes, parent information letters, even though those might not be always necessary, but we did include them, and a tick check calendar, all based on appropriate grade level. So it is split into 3 different ones depending on grade, and you could choose what's most age appropriate. So I always like to share this with anyone at the school level because there's also resources. Let's say you can hang in your nurse's office or classroom and things like that. There's also activities that you could share. We have seen a lot of phys ed teachers adopt the toolkit, which is great. So I always like to mention it to get it out there. And we'll also be sharing a link to that toolkit in the chat. I did also recently just put up an evaluation for that too, so that everyone or anyone who uses it can provide feedback just to see what we can improve. Here you can see a tick word search and the tick check calendar that I mentioned on the last slide. So the tick check calendar is neat because it could be used either as a form of reward system for assuring kids do a daily tick check upon returning from indoors. So even if after recess you did a quick, you had the student do a quick appropriate check or something like that, or to send home to do at home after they spent time outdoors, that could also work. And then on the left-hand side, you just see a word search that is in one of the sections of the toolkit. For anyone interested in data or showing the importance of teaching tick-borne or even vector-borne diseases in schools, you could find this dashboard on our website, the vector-borne dashboard. Sorry. The dashboard uses interactive data visualizations to display vector-borne disease case data. So you could find case counts and incidence rates, things like that. Emergency department visits for tick-related illness, and vector-borne pathogen data in mosquitoes and ticks. You can easily access the dashboard by navigating to any of our vector-borne pages, and you'll see a link to it in the corner of each page, or even on the Fight the Bite main page. That may be one that most people are familiar with. And then once you open it up, you can proceed to search for data on specific vector-borne diseases, see what's going on mostly in your area or county, things like that. So here I have a list of just some upcoming and new materials that we're working on. I briefly mentioned before the alpha-gal syndrome brochure that it is currently available on our tick-borne webpage and on our alpha-gal specific webpage, and it is being printed. Like I said, if any new evidence comes out or research comes out, we will be updating that regularly. And if that's happening, you'll see currently being revised or something to that effect in the right-hand corner of where it's listed, just to know that there are revisions being made. I also did somewhat of a toolkit for summer camp, which may be indirectly related, but I think it's still information that can be used in the classroom, in the nurse's office, things like that. There are flyers targeted towards campers, towards camp counselors, and then also towards parents. So it could be great with summer coming up, even some schools themselves partake in camp, or some teachers and things like that may work at camps during the summer. So you wanted to make sure that we have that out and ready to go. It is undergoing the approval process, but should be up soon. And you'll also see that within camp guidance if any of you need to look at that. We are going to also be doing a little revamp of the toolkit, just to make sure you know that it's always up to date, that it's as engaging as possible. So that's why I really want to stress, if you do use it, please do take that brief evaluation, just share any recommendations, suggestions, things like that, or even what worked or didn't work for your setting. That would be great. Lastly, May is Tick-Borne Disease Awareness Month, so it's a perfect time to be doing this presentation. I thought the timing of it was great. So be sure to follow or take a look at any of our social media platforms, Instagram, Facebook, things like that. I did plan out a month long, and now I believe almost half the month is over or more, right? But there is a month-long campaign going on of different tick-borne disease awareness posts, including some on information on the toolkit, how to prevent diseases, and just things that are very useful to know. And starting to wrap it up, I just want to mention and go into a little detail about what New Jersey as a state is doing about tick-borne diseases. So New Jersey Department of Health communicates with the local level, so local health departments and healthcare providers through health alert messages and conference calls to increase awareness and share information regarding tick-borne diseases. New Jersey Department of Health Communicable Disease Service, or CDS, has staff dedicated to monitoring, controlling, and preventing vector-borne diseases. Specific activities performed by vector-borne illness staff include surveillance of vector-borne diseases, identifying risk factors, monitoring trends, providing technical assistance, and training and educating the public. There also is something called a interagency vector-borne disease work group, which is where we address public health issues of vector-borne diseases in New Jersey. These meetings are forums which in federal, state, and local partners in the state share information, develop recommendations, things like that, and just keep each other updated. This includes everything from vector-borne professionals, mosquito control people, things like that. And then, of course, we post information to our DOH website. I do urge you to visit the website, not too soon since we are updating the CDC links, but everything on the New Jersey end should work if you'd like to take a visit to the website right after this. So I do like to mention credible sources. We all know that it's easy to find misinformation online, but we do always suggest the CDC website, and you could find 2 links here. These 2 are in fact updated. And then also our main Fight the Bite page, which once you're there, you could bring yourself and navigate to the different tick-borne or mosquito-borne disease web pages. And so now I'm going to stop sharing and I'm going to turn it over to Amy.
Thank you so much, Michelle. That was a wonderful presentation, and we just wanted to go through and hit on some of the big topics. So you can go ahead and join kahoot.it and then enter this game pin that will also be dropped in the chat, or go ahead and scan this QR code. And as soon as I start seeing a good amount of people pop up, we will go ahead and get started. Lots of people joining. This is awesome. All right, I'm just going to give it 1 more minute, and once I start it, you will still be able to join using this game pin. It will be down on the bottom, and it's also being dropped in the chat. All right, and just a little update about how Kahoot works. If you're on your phone or on the computer, the corresponding answers will go along with a shape and color on your phone. So you'll have to watch my screen and then pick the correct answer. So I'm gonna go ahead and start, and like I said, you can still join. All right, and our first question here today is, what are some common symptoms of tick-borne illness? And like I said, you can still join down here. Here is the pin, and then you can go ahead and pick the corresponding color and shape. All right, so the correct answer is all of the above, which looks like 80% of you got that right. So all of the above may be symptoms of tick-borne illness. Symptoms will vary by type of illness, but these are common ones that are experienced. All right, the next question is, which disease is not spread by a black-legged tick? Awesome, yep, so the correct answer is spotted fever. This is spread by the American dog tick. This includes Rocky Mountain spotted fever, which is one that is most commonly heard. All right. The next question is, what is the most reported tick-borne disease in the United States? Awesome. Yep. The answer is Lyme's disease. It is also the most reported tick-borne disease in New Jersey. All right, so true or false? Every person infected with Lyme's disease displays the bullseye rash. Oh, everyone's super quick with this one. Yep, the answer is false. So about 70 to 80% of people diagnosed with Lyme will develop the EM rash, also known as the bullseye rash. The appearance of the rash may also differ from person to person. You may refer to the slide that Michelle went over earlier with all the photos for more details. All right. So which is not a tick-borne disease prevention method? Awesome. So as Michelle said earlier, you should stay on the walking path when available and out of the leaf litter. So the correct answer is walking off path and in leaf litter is not a tick-borne disease prevention method. Ticks are more likely to spend time in the leaf litter and more encounters will happen off of the path towards the wooded areas. All other options are tick-borne disease prevention methods. We recommend that the insect repellent be EPA registered insect repellent. All right, the next question. When removing an attached tick, use tweezers and exactly, the correct answer is pull straight upwards. Michelle shared a great photo with us of tick removal, which you may refer to. You do not want to twist the tick, but rather pull straight upwards to ensure all of it is removed. After removing the tick, thoroughly clean the bite area with rubbing alcohol and clean your hands with soap and water. As a reminder, never crush a tick with your fingers. Dispose of a live tick by putting it in alcohol or hand sanitizer, placing it in a sealed bag or container, wrapping it tightly in tape, or, like Michelle said, her favorite, mine as well, flushing it down the toilet. And our last question here today is true or false. The tick toolkit is for grades K to 12. True, exactly. The tick toolkit is a resource for those in grades K to 12, and the lessons are split up by grade level. This helps ensure that the information is understandable for all of our students. Tick-borne illness prevention is an important topic to teach all of your students. The resources shared will link you to the webpage where you can find the toolkit materials. If you or any of your teachers utilize it, please be sure to take the evaluation